Syed Abbas, every country is looking at this as a priority issue right now. You know, we can be certain that it's going to be first quarter, second quarter next year, you know, give or take a few weeks this way or that way. The one thing we can all be clear about is that every country is trying to make sure that they get it as quickly as possible.
Yeah, that's correct. And let's see, there are various factors on which we need to look at. Let's talk about India. You know, some of the countries have secured the number of vials from some of the key pharmas and manufacturers early. There'll be early B to get these vaccines, and India is one of them because we are manufacturing these vaccines in India for Novavax, for Oxford. And the good news is that for Oxford, the interim analysis of data has shown positive result. And until unless there are any negative surprises coming in from the analysis of phase 3 data, we should be able to get the emergency authorization of vaccine in India by January sometime.
Yeah, that's amazing.
Serum Institute of India has already manufactured. They have started manufacturing long back, 2-3 months back, and they're ready with 40 million of vials. So as soon as we get DCJ approval, we can start administering the vaccines for the healthcare workers, frontline workers. That can be done anytime in February if everything goes well. So coming to the rest of the world, not all the countries have. The early countries are some countries in Europe, Japan, Australia, Singapore. I don't think they have done it, but some of the pharma companies they have made a strategy of manufacturing, in different countries. For example, Oxford, they're manufacturing in India.
Yes.
They're also manufacturing in Thailand. And so for Southeast Asia, the distribution will be done from Thailand, not from India. And India will be catering for the Indian population as well as some of the other, developing countries.
Other countries, yes, countries. That's right.
Exactly.
Yeah.
So these are the key distribution strategies which the pharma companies, along with the government, they have made.
No, that's very useful. What you've shared is very useful. The distribution strategies is also going to dictate, when each country gets those vials, because it is only then that the government of each country can get those vials out to the population. So as you said, the Serum Institute in India is going to be manufacturing the vaccine that's being developed in Oxford. Dr. RC Sharma, this is truly a global effort. There are so many parallel vaccine development efforts that are happening in different parts of the world. How are countries choosing between these vaccines? One would assume that everyone understands this, but how is, because each vaccine appears to have a different efficacy level. What is that choice like? How do experts make that choice?
Thank you for having me. Well, in 10 seconds, I'll tell you about US, where I am.
Yes.
Now, Moderna and Pfizer are here, and they claim this vaccine about efficacy more than 90%. Again, it has go through with the various agencies to verification and all that. But if everything goes well, by end of December, Dr. Albert Bourla, the Pfizer CEO, and Ungar Sahin, BioNTech CEO, has claimed that 20 million they will produce by end of December. And the priority will be the healthcare worker, elderly, and people with morbidities, diabetes, hypertension, and so on. So this is about US at the end of this year.
Yes.
Again, by next year, in 2021, both of them claim they will have 1.3 million vaccines.
Yes.
And that will be distributed to all over the world. 1.3 million is much more than what US can consume. So that is where it is with Moderna and Pfizer.
Okay.
Again, the vaccines storage of these two seems like a little cumbersome for compared to AstraZeneca and Oxford Jenner Institute, but and price-wise also, I think they are cheaper as AstraZeneca one.
Yeah.
But they are based in Oxford, UK.
Yes.
So their vaccine will be distributed first to UK.
Correct.
And then to other European countries, and then only it will cross over to other nations. What the arrangements are between nations I don't know
Yes.
exactly.
No, we have that information.
But that is how it's going to be.
Yes.
And I tell you, sometimes we create more smoke even if the fire is not lit. So vaccine, general population, and I am in contact with many people from my school in Bihar, in Netarhat and other places, and they think vaccine is there. No reason to wear a mask.
Right.
Distancing.
Absolutely, yes.
And that's exactly my mantra. This is going to stay. Do not know when this 70% herd immunity will be achieved. Nobody can say. Because who will not take the vaccine, distribution, administration, and so on. So MSD, mask, soap, and distance.
Yeah.
Continue this for the time being, at least for years.
I'm going to underline that in red. MSD, masks, soap and distance is a great mantra. No matter, what, recently on social media, I was joking about this. And I said that the day that the vaccine arrives, we're probably going to have a scene at Delhi's India Gate, which looks like when India won the Cricket World Cup. And I seriously hope that is not the case. I love India's emotions. I love how Indians embrace emotion, but this is not something to be stupid about and ill-informed about. This is about our lives and the lives of our loved ones.